Lellman is a low-income, unincorporated city in Pinellas County, Florida. Settled in the 1800s and made up of farmlands. In 1872, the founder Elza Lellman and his family built a large homestead which still stands today. Elza and his farming neighbors loaded their farm goods to the Orange Belt train depot, which was later referred to as Lellman Station. This community grew slowly into a residential neighborhood. Low-cost housing began to be built in the 1950s. The residents here have been struggling to improve their community. They have upgraded Joe's Creek and constructed a new facility and park. In 1999, they obtained their own fire department. Lellman is one of 5 communities within Pinellas County that has been included in a community redevelopment area, also known as CRA. Business owners and residents are involved in this 30-year plan to revitalize and improve this community, which will provide the people with appropriate public resources. Improvement plans will be discussed throughout this presentation. Lellman is approximately 2,525 acres in size. It has 1,422 acres of zoned residential land. 46% of these are older single-family homes that are in need of repair and updating, with only a handful of new constructed homes and some older apartment complexes. 2% are duplexes, 27% are mobile homes that are scattered throughout Lellman, and greater than 50% of them are rundown and dilapidated. 46% homes are owner-occupied, 36% are renter-occupied, and 2% are vacant. There are no provisions for the homeless. Many churches in this area provide resources of food and monetary assistance for emergencies. Solid Rock Christian Church offers a 90-day in-house drug and alcohol rehabilitation program, which is usually full due to the high rate of alcoholism in this community. The road system is in poor condition, and routes do not meet the needs of the community. Many residents rely on the bus system and must make transfers to reach their destinations. Major corridors are in need of repairs and sidewalks, and many are not served by the bus system. Deficiency of sidewalks and bus amenities decreases safety to residents in this high-traffic, congested area. The business structure of Lellman varies. The need for food options are not met in this community. There are no grocery stores, and there is limited healthy food options. It is filled with many fast food restaurants and convenience stores and liquor stores. Lellman does have a few positive structures that provide resources for their community. There is a Lellman Asian Neighborhood Family Center. Services include after-school care and activities for children, family support, and computer, literacy, and financial classes. The Pinellas County Sheriff's Athletic League, PAL, is another free center for children for after-school activities. The Bay Area Pregnancy Center provides free services to women, children, and families that offer pregnancy and infant care, parenting classes, food, baby supplies, educational opportunities, and referral systems. Due to the high poverty levels, low educational levels, and high unemployment rates, there is a number of health concerns for Lellman's vulnerable population. Comparing the health concerns of other communities in literature, the following health concerns for Lellman are identified as: poverty is holding them back from seeking proper medical treatment and health prevention. They need access to free healthcare services and community-based wellness programs. Communicable diseases such as STDs and hepatitis have had high percentages in Pinellas County, far above national averages. This needs to be addressed through prevention, education, and accessible health services. Cardiovascular disease is prominent, related to the high number of smokers observed, limited resources for healthy food, and poor access for physical exercise. Obesity rates are double the Florida average. Residents lack exercise and healthy eating because of deficiency access to fitness trails, functioning sidewalks, and discounted grocery stores.
When assessing the health-related resources of Lellman, there is some area of concern. Access to grocery stores is outside the community. There are only small convenience stores for purchasing grocery products, and food costs are higher and have less nutritional options. There is public transportation through busing, which has limited routes and a monthly financial burden of $120. Walking to the main bus line from the home can be a burden for physically challenged individuals based on our observations. Taxis are available, but price per mile can be cost prohibitive. Pinellas County Redevelopment Plan is attempting to address these issues to decrease community burdens. There is an adequate number of hospitals and clinics to meet the needs of the community. However, there are still problems with affordability to healthcare resources. This is being addressed through programs within the Department of Health. Heart disease is the leading cause of death in Lellman, and nationwide, 43.7% of deaths in Lellman were related to heart disease. Based on review of Healthy People 2020, this must be addressed in the community through prevention, detection, and treatment. The best way to do that, according to Healthy People 2020, is nutritional education and lifestyle habits combined with healthy weights, regular exercise, regular annual physical examinations, screenings, improving the surveillance system used to identify risk populations, and by ensuring improved access to health care that is both affordable and accessible. The second leading cause of death in Lellman, at 43% in nationwide, is cancer. Healthy People 2020 has the goal of reducing the number of new cases. Cancer risk is increased by the use of tobacco, poor nutrition, sedentary lifestyle, and obesity. By addressing these issues in community education programs, early screenings, and health prevention programs, and smoking cessation, Lellman can decrease their death rates from cancer. The goal of Healthy People 2020 is to prevent sexually transmitted diseases and its complications through increased access to services, strengthening the community capacity, and to promote healthy sexual behaviors. With the rise of STDs and the cost and burdens placed on individuals in the community, this is another important goal. Interventions should be aimed at educating the public on the risk of STDs, complications of STDs, HIV increased risk, congenital risks, and preventative measures. Adequate resources and facilities must be in place and accessible to Lellman residents to decrease the community burden.
Testing levels of the water supply showed the water to be safe. Lellman has appropriate contingent plans in case of water emergencies. The air quality is good and is high above the national average. However, residents are not adhering to rules and regulations to protect the air quality. We observed multiple residents burning hazardous garbage. The garbage and disposal services are provided by a private company that charges $168 a year for trash removal. They have no recycling programs or drop-off sites. Sewage route renovations are in progress, but they still have drainage system problems with heavy rains in their low-lying areas. The need for drainage systems improvements are being addressed in the CRA. The Lellman Fire District is a great asset to this community. Along with emergency services and management, they also have departments that provide fire safety inspections to multifamily homes and commercial properties, and a code enforcement unit enforces compliance of property codes. Lellman is known to have a high crime rate. They would benefit to have their own police department with personnel that lived in this community to increase response times. The Pinellas County Sheriff's Department is now responsible for patrolling their community.
Lellman falls under District 1 with Janet Long as a commissioner. She has a website listing with ways to communicate and how to schedule a meeting. The Board of County Commissioner meetings are open to the public and citizens can request to speak. The seating is available for 60 people with about a third of the seats empty. Considering the size of Pinellas County, this is very poor public attendance. If you're unable to attend a meeting, you can view it on PCC TV via live streaming or on the website archives. The Lellman County Redevelopment Area Advisory Council has its meetings posted for the year with location, time, and point of contact. Their website also lists the minutes of previous meetings and links to additional sources. The site is very well organized and meetings are open to the public, and attendance is good because of the direct effect on the community. Based on review of its government structure in the CRA, Lellman has economic concerns related to the community improvements that are slowly being addressed. The plan has some monetary amounts attached to it, but that allows the community representatives to access and prioritize the community needs. Unfortunately, the needs for Lellman are great, and the budget is not adequate to meet all those needs. The committee has also addressed the political and public policies in Lellman that were a problem in the past. Using Maslow's hierarchy of needs of food, water, safety, and security, recognized as basic needs, and then prioritizing the list to have the greatest impact, the following 6 community needs were identified. 1. Grocery stores are needed, preferably discounted, so that people can obtain heart-healthy food choices and decrease their heart health risks. 2. Lellman needs better functioning sidewalks, fitness trails, fitness centers, due to heart disease being the leading cause of death, and exercise reduces cardiac risk. Also, sidewalks are needed for safety and security of residents. 3. Lellman needs more affordable housing and programs to address the discrepancies between wages earned and average housing costs in the area. This was identified in the Lellman CRA due to high poverty levels. 4. Lellman needs a homeless center to address the needs of the homeless population in Lellman. Nearest facility is 3 miles away, and this is both a hardship to the homeless and a threat to the safety and security of the community. 5. There are no free clinics within the boundaries of Lellman to meet the needs of those in poverty who cannot afford to use the clinics that charge for service. 6. Lellman needs improved community health through improvement of sanitation and water lines, as well as improvements to street lighting for safety and security of residential areas as identified in the Lellman CRA Action Plan. On a global level, the issue of proper nutrition in Lellman can be compared to Japan's realization that nutrition has long been underrepresented. Poverty has placed nutrition as a high priority on a global spectrum. The USAID and World Bank realize that the emphasis on the importance of nutritional interventions. Addressing nutritional deficiencies in Japan is taking a multidisciplinary approach. They are focusing on economic, social, and political factors, just as the health department here has recognized that a multifaceted approach is most effective in improving the health of our communities. They are focusing on educational resources to train individuals to become specialists regarding global nutrition. The goal of both Japan and Lellman's community leaders is to protect people from hunger, undernutrition, and obesity. Lellman has many community facilities that offer food banks and nutritional educational opportunities. The CRA plans to bring grocery stores to Lellman, and a community health nurse can educate people on healthier food choices, resources for poverty-stricken residents, and the impact of healthy lifestyles to improve overall health.